Well, with the site of the Newport Health Center looking more and more like it will as the contractor completes the exterior, YCN caught up with the president and CEO of New London Hospital, Bruce King. We asked him if it looks like they'll meet their targeted goal for finishing the project this fall.
Our new Newport Health Center is well underway. We are targeting actually completing on time and on budget. It is scheduled to be occupied in early October, at which time you will start to see the existing clinic being raised and demolished so that that will become more parking and landscapes. We hope to actually have the entire project completed by early fall. It's actually 28,000 square feet. It's about 75% larger than our existing site and all brand new. For those of you who recall, that was formerly part of a food store that had been renovated and retrofitted to become a healthcare space. Further, a couple of years ago, listeners may recall that we had a significant roof leak. So it's a pretty dysfunctional, non-patient friendly. The notion to sort of invest in Newport, much like we have done in New London 5 years ago, in a new high-quality space. The expanded space will be fully handicap accessible. We will have additional space for specialty clinics that today are only conducted here because we have no room. So many of the visiting Dartmouth-Hitchcock specialists, in the areas of oncology and cardiology and dermatology, we will be having in both locations. It's kind of a very exciting project to be able to build brand new, to have a two-story building going up and to revitalize the community. Yeah, very pleased to be able to announce publicly that we're going to be working collaboratively with Valley Regional Hospital, a fellow hospital that's part of the New England Alliance for Health that New London is part of. As people may be aware, there are primary care offices for both hospitals in that town. As part of our fundraising initiative, it's a $9 million total project. We have a $2.2 million capital campaign. About $1 million has been pledged and/or committed. As part of that, we were actually stimulated by the local businessman Royal Malul, who actually encouraged the dialogue between Valley Regional Hospital and New London Hospital. Peter Wright is the CEO of Valley Regional Hospital. That prompted Peter Wright and I to start to work together, and we actually forged a relationship where they will be leasing space within our building for their primary care providers. They actually have 1 or 2 primary care providers and a small staff that's on Main Street. They will stop that lease and become part of our health center. It will still be separate. You have Valley physicians and New London Hospital physicians. Any ancillary services, lab, radiology, x-ray, will be done at the New London Hospital, but we'll sell that service back to Valley. So it's a way for us to work together, to be seamless, to eliminate 2 different locations, and we're very excited about that. Part of the stimulation for that was Roy committed a $350,000 gift, which is a very generous and the largest gift that we have received, and that's part of the $975 that we are talking about that's already in pledged.
Now, with the mild winter we had this year, it looks like there should be a grand opening this fall as hoped for. If you are interested in learning more about the project or would even like to donate to their fundraising campaign, you can simply go to newlondonhospital.org and click on Ways to Support. Next week, we'll talk to Bruce King once more about how medical care has changed and the ways that it's becoming much more effective and efficient.